So let's move on and talk about the blood tests. Now, it's the blood tests that are going to definitively tell you that it is, in fact, iron deficiency anemia, and also give you a better clue as to why it could be iron deficiency anemia. So, the first is going to be your CBC, and of course, the CBC is going to give you your hemoglobin, your hematocrit, and your hemoglobin level. And so, if you see a lower level, you know that a lack of iron might be the culprit for that. You also will see your MCV, your mean corpuscular value, and that is the size of the red blood cell. And so you're going to see a smaller than normal. Here's normal. You're going to see a smaller than normal red blood cell with this test if it's iron deficiency anemia. You'll see your mean corpuscular hemoglobin concentration, and you'll also see that decreased because of the reduced amount of hemoglobin. Next, you have more specialized tests, and one of these is a reticulocyte count. And what a reticulocyte is it's a very young, immature red blood cell. And so you'll see a lower value on this, and that could be indicative of a problem with hematopoiesis in the bone marrow. The bone marrow is struggling to get blood cells out and basically pushing it out too quickly. Now, the next one is the peripheral smear, and what that is basically what it says. Some blood is taken and smeared on a slide, and the size and shape of the blood cells are examined. And what you expect to see with iron deficiency anemia is that some of the cells, and many of the cells, are smaller, just like in the MCV value. And what you're going to see is that they're not uniform in size. They are not all the same size, unlike somebody who doesn't have iron deficiency anemia. Next, you're going to check to see how much iron is actually available in the body. Did the iron get into the body? And by doing that, you can rule out absorption problems. Iron and ferritin, both of them are forms of serum iron circulating in the bloodstream. You expect to see lower values. Next is the transferrin level, and remember that's the enzyme that binds to the iron and carries it around in the body. And its partner test is the TIBC, the total iron binding capacity. And what that is it's basically seeing how much iron is on the transferrin available to be used by the body, and you would expect that to be high in somebody who has iron deficiency anemia. So what does all of this mean? What does all of this mean for your patient? We have a patient here, and some of the lab values that we've just been talking about have come back, and we're going to go ahead and say that he has a diagnosis of iron deficiency anemia now. And so your patient's looking at you saying, what do I do? What do I do with this? What does all of this mean? Help me to get better. I don't know what to do. I don't know what all this means. I just want to feel better. So we've done all of our homework here, and we've done all of the work in identifying all of the reasons for, and so keep it simple. Treat the cause. We went through all of the causes, and you'll treat the cause. So increase intake of iron, increase absorption, fix what problems there might be with absorption, and you also will check to make sure that they're not losing iron via blood loss. So once you fix the cause, then the person will get better and their anemia will resolve, and they'll be thanking you for your efforts.